The health industry is at a crossroads. Clinicians and executives both know that value-based patient outcomes have to improve, while simultaneously reducing costs to patients and hospitals. But clinical variance and other challenges are tough to track, understand, or address. In today's world, it's easy to say that the data has the answers, but it's often siloed across the organization, or it's irrelevant to clinical teams. And when it is relevant, it often isn't timely, or clinicians don't have the authority or process to make improvements. So how can you make changes that patients, clinicians, and executives all benefit from? With Deloitte Care Intellect, you have an innovative digital partner that can improve your system to better harness data, improve patient outcomes, and lower costs. In just weeks, clinicians get the data, authority, and process they need to innovate and implement data-supported bedside improvements that reduce costs and improve quality of care. First, we pull together a team of frontline clinicians to examine data on clinical variants of patients' specific medical conditions. Keeping clinicians in the driver's seat keeps doctors engaged and patient outcomes at the forefront of the process. Then, a multidisciplinary team from across the system discusses evidence and leading practices and brainstorms the root cause of that variance within that condition's treatment. From the bedside care team to executives, each process owner or impacted role is invited. Then we prioritize problems and send sub-teams out to design a new, value-based care solution. Clinicians stay in the lead, focusing on implementation and defining metrics for monitoring success. Along the way, the Care Intellect software democratizes data collection and analysis, making sure clinical teams have timely access to continuously review and improve programs based on real-world evidence. That could be financial benchmarks like identifying variable costs per procedure and margin per patient, or correlations between interventions and readmission rates or length of stay. Using that data, clinicians implement solutions, updating the EMR or other hospital processes for the most sustainable long-term impact. Based on analytics, new patient conditions are prioritized and analyzed, leading to a cycle of continuous improvement across the whole system. With every iteration, new variances are addressed by a multidisciplinary team, creating sustainable changes that bring meaningful improvement to patient care. Ultimately, this leads to better outcomes, higher morale, and more sustainable process improvement. Don't let variance keep inhibiting patient care. Activate the passion of physicians to create long-term, data-driven innovation that reduces cost, improves clinician experience, and transforms patient care. With Deloitte Care Intellect.